Sticklers Syndrome. In this video, we're going to be sharing the case of a young patient with this diagnosis. Now, let's first of all examine the eye which is phakic. And the thing that I want you to look at the most is the vitreous. Now, how would you describe that vitreous? It looks different. I mean, certainly we can see some pigmentation and some Shaver's positive sign because this patient has had a previous tear, but actually this patient does have these abnormal beaded strands and this irregular thickened stranding with almost this kind of beaded appearance. That's appearing almost like a type 2 Sticklers syndrome. So in this other eye, the patient's pseudophakic. They've had cataract surgery. You can see they've also had a YAG capsulotomy. And let's have a look at that vitreous to see what's going on there. People do often describe the vitreous of patients with Sticklers syndrome as being quite optically empty. But sometimes you can also describe maybe seeing some veils or some sheets of vitreous or persistent cortical vitreous as well. So let's have a look at the fundus and see what's going on. And bear in mind that one of the big problems with Sticklers syndrome is that this is a genetic connective tissue disorder which is associated with abnormal vitreous, early onset retinal detachment, cataracts and high myopia, which explains why this patient's had cataract surgery in this eye. And so regular ophthalmic examinations and dilated fundal examinations are important because patients can develop retinal tears. You want to safety net them very closely. There's one. You can see they've had a good retinopexy around that retinal tear. Let's see if there's any more. There's number 2, we can see. There's number 3. So clearly multiple retinal tears. And so in a patient like this, you really do need to give them very close safety net advice about the potential development of retinal tears and retinal detachment. Hope you found this video useful. And I think one of the real main take-home messages from this will be the fact that patients with Sticklers syndrome are at much higher risk of developing retinal tears and retinal detachment, myopia, but also cataract. And remember that this patient has had cataract surgery before. But the other thing that's useful is just to see what it looks like when a patient's had a retinopexy around a retinal tear as well. That's a useful appearance to be familiar with as well. Hope you found this video useful and have a good day.